Okay, welcome. This is Dr. Adam O'Brien yet again. Recognized was that how much I have learned what I didn't learn in school by my clinical practice and want to give that back to others. And so, looking at what we didn't get and whether or not it is grad school or school in general and or life in general, like we want to fill in the gaps of what we didn't get. And so, as looking at our work on the whole, really filling in the gap as to like what is going on for people, where things are coming from. People will commonly say, like I don't know where this is coming from, or um, that's news to me, or you know, I'm crazy, or um, I'm weird, or I am a lot of these things. And when people have a better understanding of the meeting area, and when they have a better understanding of themselves, and the journey that people often take with a therapist in general is often this: to find out who or what they are and what's going on, right? Well, we have a lot of those answers, and a lot of times people aren't able to connect with, a professional in that way, or they don't meet the qualifications for that. And our work highlights specifically, where that line is. And we explore that in our trainings and in our educational process. And where we have found holes in the research and or logic, we have filled it in. And so that's why I say that what we are teaching and educating on helps fill in the gaps often of grad school, whether or not it's a clinician or any type of profession, and or as our main goal is to help people become healers, and what that means. And our work defines that, and at least captures what the definition, a viable definition for legal purposes is. And so we look forward to offering, the gaps in between. It is a personal and professional journey, no matter what path you take with us, ultimately, because that's just the reality, that the people who are professionals are also people, and they need to have a clear understanding as well as to what is going on. And, that's one of the gaps that we're trying to fill in, is that we have seen professionals who were surprised at some of the training and capabilities of the things that we've been trained in. And in the bigger scale, we feel that like people need to have what we offer as far as education, particularly if there are going to be, psychedelics involved in people's lives. We have a, screening process, meeting area screening and assessment, MESA, that really helps guide people towards what is right for them, and getting unconscious informed consent from um, from clients. So, and giving it, I guess, as well, for clients to be giving their unconscious informed consent. And so we also define the unconscious, and we ended up defining a bunch of words that are pretty important for psychology to consider. So we are looking forward to hopefully seeing you at a training here in our educational program. Thank you.